Okay, so in the male model, this is both, good for urinary and also reproductive. So we have the bladder, okay, and then we have on the bladder, the posterior side, we have the seminal vesicle, and we have the prostate gland visible. So what we also have coming onto the posterior side of the bladder is the vas deferens, which is coming from the testicle. So we're moving down to the testicle, and then here's the testicle. This structure is the epididymis, okay, and then basically we have the scrotum, and it does not show you the dartos muscle or the cremaster muscle, so those are not visible on the model. The structures here around the vas deferens are basically testicular artery and vein, but the unit here would be called the spermatic cord. Okay, so the sperm are made here, mature here, move up the vas deferens, go through the inguinal ligament into the abdominal cavity, and then meet up with these two structures which contribute to the semen, and then of course we're going to go out the urethra of the penis, okay? But from the exterior view, you really just have those structures. So we want to look at the penis. We have the root is attached to the body, the shaft or the body, the interior of the bladder, the rugae, the detrusor muscle. We find the urethra coming away. So this is the as it goes through the prostate, this is the prostatic urethra. So here's the prostate gland. As we go through this muscle, this is the urogenital diaphragm. So at this point, this is the membranous urethra. And as we go through the rest of the penis, this is the spongy urethra. And the pink tissue here, this indicates the corpus spongiosum, okay, that the urethra runs through. The purple color is going to indicate the corpus cavernosum. And you have two. So let's go back here. So this little offshoot of the urethra is called the ejaculatory duct. Okay, so this does not have urine going through it. This is specifically just for the semen and sperm. Okay, but as soon as it's a common space where urine also flows through it, then it's called urethra. Okay, I think that's pretty much it. Oh, let's go down here. So when we cross-section the scrotum, you can see the skin. And then this muscle layer around, that's part of the cremaster. Okay, so that's going to be part of the internal oblique that can come down and raise the testicles. On the glans penis, we have the skin around the glans, so that would be called the prepuce or the foreskin. Okay, so that's pretty much it. Reproductive and urinary. What we can see actually is the broad ligament is going to be on top of the uterus, and then we have the ovary in yellow. We have this structure here that actually holds the ovary to the uterus, so that's called the ovarian ligament. Okay, and then here we have the fallopian tube or the uterine tube. The fimbriae are at the ends, and then in this area is called the infundibulum. Then we have the ampulla, and then the isthmus is the part that goes into the uterus. Then we have the bladder out below it, so it's a urinary bladder. And actually, if we look here, right, this is the vagina. So we have the uterus and the external vagina. Okay. As we come down here, what we can see are, we can ignore the blue. There are different glands. This is the labia minora, and also here, and then this skin here is the labia majora. This sort of pad of fat, that's called the mons pubis. In this region also we can see sort of the anal sphincter that goes around here. So that's that. And then we can take this away, and then we can see the interior of the uterus, and it shows you basically the three layers. So the pink in here is the endometrium, and then we have the myometrium, that's fleshy colored peach, and then the perimetrium in the white. And so the uterus has three parts to it. So there's the fundus, and there's the body. Oh, actually 4 parts. The isthmus is not really sort of visible, but it narrows as it reaches the cervix. So the border between the uterus and the vagina is called the cervix. The little hole is the os. The vagina here kind of comes up and goes around the cervix, so that's the fornix. And then we basically just have the wall of the vagina as it comes out. And if you, the hymen would be here, sort of a, it can be a complete membrane or a partial membrane. If we look here, we have the bladder, and then this is the urethra. Okay. Here, this indicates the clitoris, and that's pretty much it. So here's the pubic symphysis, and if you wanted to look in here, also there's just, again, another ovary, the fimbriae, the uterine tube. This is the ovarian ligament, and that's good.